Hi everyone, my name is Leilani Zarate from UMass Global. We're presenting a PowerPoint regarding statistical significance and clinical significance with my classmate here.
Hi everyone, my name is Uzoma Wadike. We are Group 3, so listen to our presentation. Thank you all.
Most of the time, it is misunderstood and misinterpreted that the findings of hypothesis testing relevant to the statistical significance is measured to judge the results of clinical significance. In fact, they do not have the same purpose and function. Their scope is different from each other. Now let's listen to the definition and importance of statistical and clinical significance.
Definition of statistical significance and clinical significance. Statistical significance is the standard for assessing the importance of measured effects. It is a scientific evidence of importance according to Hayek 2010. It is a measure of probability of the null hypothesis. It is a probability that the information studied can be correct or incorrect. Clinical significance is a subjective interpretation of research findings as meaningful for patients under care and influence the behavior of healthcare providers. It is acceptable findings. Believe that finding is considerably enough to be medically crucial and applied as guide in provision of care to patients. Statistical significance and clinical significance. How are they individually important when looking at research? I'll explain. Statistical significance proves that the findings are unlikely to be explained solely by chance or random factors. Statistical significance proves that the findings of a research has a very low chance of occurring if there were no effects in a research study. Statistical significance, the use of null hypothesis and p-value in research, provides an accurate clinical result. Clinical significance is important because it addresses validity and accuracy in the result of a research. It measures the effectiveness of an intervention or the efficacy of a treatment modality. Clinical significance considers the design, sample size, effect of the study, bias incorporated of the study while analyzing study results. Clinical significance facilitates understanding and interpretation of results for clinicians.
Thank you, Uzoma. Now we will discuss the example for clinical and statistical significance. There are two different chemotherapeutic drugs that are being studied, drug A being less expensive and drug B being more expensive. Drug A estimates to increase the survival of treated patient by 5 years. The p-value here is 0.01 and alpha value being 0.005. Drug B estimates to increase the survival by 5 more months with a p-value of 0.01 and alpha value of 0.005. The value of p 0.01 means there's moderate evidence against the null hypothesis. Alpha, or the significance level, is the probability of rejecting the null hypothesis when it is true. The value of 0.005 reduces the occurrence of false positives, making it more likely that the estimates represent real results. The statistical tests of both drugs are significant, meaning that the observed result is unlikely due to chance. However, the clinical significance show that drug B is not clinically significant since it increases the survival by only 5 months. It is not useful in terms of cost effectiveness and superiority compared to available chemotherapeutic agents. Knowing the definition, importance, and cited example of a research study, we can now utilize the difference of clinical and statistical significance in our future research studies through reading, analyzing, and evaluating the findings of the study, having in mind that the statistical significance and clinical significance have different purpose and framework. These are the references that we use for our presentation. Thank you for listening.